wake up, morning, noon, and bedtime.
Running a pharmacy is in Roger Paganelli's blood and bloodline. He's the co-owner of Mount Carmel Pharmacy, a neighborhood institution for the last 57 years. He and his brothers run the store together after inheriting the business from their father, also a pharmacist, about 30 years ago.
Family is family.
Some of the employees have been around so long, it can be hard to tell who's actually related.
I have actually 2 work moms.
Paganelli's staff is close with their customers as well. And when the coronavirus pandemic hit, the neighborhood and the pharmacy's client base was devastated.
We've lost more than 50 patients.
Now Paganelli is trying to be part of the solution and preparing for the role his pharmacy will hopefully play in distributing the vaccine.
So I just finished a webinar with our national vaccine partner, who is part of the CDC vaccine administrator program, with some of the bigger vaccine administrator programs. Some of the large chain pharmacy names are in there.
The problem is state and federal officials haven't given them a timeline. Right now, the federal government has contracted only 2 for-profit pharmacy chains to administer the vaccine, CVS and Walgreens. The president of the Pharmacists Society of the state of New York want independent pharmacies like Mount Carmel to be utilized as well.
We have over 2,000 pharmacies in New York State that are community-based pharmacies, independent pharmacies. And so that's a lot of vaccination centers.
But getting independent pharmacies into the mix isn't a given. D'Angelo says New York State pharmacists aren't automatically eligible to administer the vaccine and have to go through an additional approval step that still needs to happen.
It has been a little slow. I think it could go a little faster.
Both D'Angelo and Paganelli add that independent pharmacies have the trust of their clients, something that could prove invaluable in trying to encourage people who don't trust the vaccine to get it.
You're talking about, community pharmacies. They've been there for generations. These people, we know their kids, we know their mother, we know their father, we know, the parents. They come into our pharmacies. We're the most accessible healthcare provider.
While not his primary concern, Paganelli does hope that by being able to administer the vaccine, that it may be the financial shot in the arm, so to speak, the business needs to survive the pandemic. In the Belmont section of the Bronx, Angie Gonzalez, New York 1.